Children have been the hardest hit by Yemen's cholera outbreak, accounting for half of the nearly 180,000 people currently infected. The UN humanitarian chief described the outbreak as a man-made catastrophe caused by the warring sides in Yemen's 27-month-old civil war.
The numbers are absolutely staggering. It's getting worse, and the cholera element, in addition to all the lack of food, the lack of medical supplies for people, is, of course, primarily one has to put that at the door of all the parties to the conflict.
Oxfam is calling for a cholera ceasefire. Its humanitarian director says governments backing the warring factions are stoking the conflict instead of prioritizing the humanitarian crisis.
Governments who are providing generous funding are also making money from supplying weapons, munitions, military equipment, technology. They're providing logistical and financial support for the military action taking place. This is fuel to the fire, not helping reducing suffering on the ground.
The disease is caused by ingesting bacteria from water or food contaminated with feces. Of all the infected so far, 1,200 have died, according to the World Health Organization. Yemen is also on the brink of famine, with about 17 million people uncertain of where their next meal will come from, according to the World Food Programme. A hospital in Yemen's port city of Hodeidah struggles to cope with severe cases of child malnutrition. And this doctor says beds and medical supplies are also running low in her ward.
There's an overflow of patients, with 10 or 12 patients daily and sometimes more. The number of malnutrition cases has spiked in recent times, more than the department can take.
UNICEF warned last year that nearly 2.2 million children were acutely malnourished. Mariama, Diallo, VOA News.